Hi, I'm Dr. David Rapaport. I'm the founder and medical director of Cool Spa, and I'm here to talk to you now about instructions following breast augmentation. Generally, you could look at these as instructions following breast surgery, although some of the things are going to be specific for people having breast implants. It is very important after breast surgery to understand your instructions and to follow them, because a surgeon can do a terrific job and it really can be messed up by improper activity following surgery, and some of the problems that could happen can be frankly difficult or impossible to fix. So it's really important to understand your post-operative instructions and to kind of understand them preoperatively. So let's give it a go. You're going to be having breast augmentation in my office facility. You will have an escort take you home. You must have somebody take you home and spend the entire night with you. It is not acceptable to just have somebody take you home and leave you there even after an hour. When we say all night, we mean all night, and that's because even though it's rare, there is the risk of bleeding after the operation, and you cannot be in a situation, you can't let yourself be in a situation where you're going to be home alone encountering a problem such as a hematoma where one breast is bigger than the other. You need to understand that legally you're incompetent after general anesthesia for the next day, and you should never even consider putting yourself in a position of being alone dealing with these problems. In terms of position, you're going to get home and the person who takes you home is going to put you in bed, and you should be laying in bed with your back elevated, not just pillows under your head, but pillows or a blanket or a wedge under your back, so you're maybe at about 20 to 30 degrees. You'll find that'll feel more comfortable for your breasts, and that's just a better position to be in terms of gravity and swelling. So that's how I'd like you to be for at least the first couple of days. Another thing that not everybody remembers is ice. Putting cold compresses, you don't want to put ice directly on your skin, you don't want to get frostbite, but putting cold compresses, what I say in this cleavage area, can be very useful. Ice really has a great effect on reducing pain, and it doesn't have the side effects that narcotic or other painkillers may have. So really think about that. Cold compresses, 20 minutes on, 20 minutes off, that first evening, that first night, might be very, very useful for you. You're going to find yourself in a surgical bra that was placed on you after the operation. You may or may not have an elastic band over the upper part of your chest. You basically want to leave those things intact, and in general, we don't want you to take those things off, and we don't want you to shower until after your first post-op visit, which is generally 2 or 3 days following the procedure. Again, your individual situation may be different, and you'll get appropriate instructions based on your own situation. In terms of activity, that's really the key thing here. Here and there, you're going to hear plastic surgeons advertising rapid recovery, breast augmentation. I really have a problem with that whole thing. When we're doing a breast augmentation, I'm creating a space. It's a space that doesn't exist. If we're going under the muscle, as I said, I'm dividing the lower part of the muscle. So I'm cutting through tissues, I'm coagulating blood vessels. Even if everything is done perfectly, meticulously, and you don't bleed one red blood cell, there are still blood vessels that are sealed off. And for that reason, I recommend really limited activities in terms of aerobic activities, as well as things like alcohol for 2 full weeks after the operation. Because again, everything may look good and feel perfect. And actually, I'm worried when a patient has no pain at all, because then you might be more likely to get carried away with your activities. So the way I put it, I want limitation of sex, drugs, and rock and roll for 2 weeks. What do I mean by that? Sex is a form of aerobic activity. We don't want any aerobic activity, and that really is irrelevant whether the breasts are involved or not. Sexual stimulation dilates blood vessels. Similarly, alcohol dilates blood vessels. We don't want you flushed. We don't want your blood vessels opening up, because a blood clot can come off from the top of an relaxed blood vessel and cause bleeding. And in fact, in my 25-year career, I've had 2 women have complications with bleeding between 10 and 14 days after breast augmentation, one engaging in sex, the other one engaging in pretty simple physical exercise, but it was still exercise. So I encourage walking from day 1, meaning the day after the operation. Walking around is great, as tolerated, first time with somebody next to you. But while walking is great, exercising, getting your heart rate up, huffing and puffing, those things are not recommended. The other, by the way, negative of alcohol is that it can cause you to be disinhibited, and then, one thing might lead to another, and you may be doing things you shouldn't be doing. When I see you at the first post-op visit, I'm going to advise you on massage, whether you need the scooping massage to help lower the implants, or just the maintenance massage where you kind of move them in the pocket gently every day just to make sure that you're not developing capsular contracture. You may or may not be prescribed Singulair, which is a drug that can help treat and possibly help reduce the risk of capsular contracture. If you've been prescribed that, we want you to start taking that the night of your surgery, meaning after the surgery that evening. We do encourage range of motion, so that's not exercise, but basically whether I went through your underarm or went under your breast, the day after surgery, it is a really good idea to raise your arm just gently straight over your head. Once you do that, you'll realize that you can do it, and it'll make your motion in general better. But I do want you to be able to raise your arm directly straight up over your head within 48 hours of surgery. Not with resistance, just passively is fine. So hopefully we've been able to review your postoperative instructions, and this will be beneficial to you. Again, if you're not a patient of mine, please follow the instructions of your surgeon. And if you are a patient of mine, please be aware of any specific instructions that we're giving you. I thank you and wish you good luck.